From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Hi, and welcome to the Psych Health and Safety Podcast. My name is Jason and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. But before I introduce our guest and topic for today, allow me to introduce my co-host, Joelle Mitchell. How are you today, Joelle?
I found a new old podcast that I've been listening to.
Yeah, which one's that?
So I like a podcast about a TV show.
Mm-hmm.
So this one is for The Good Place.
Ah, okay, yeah.
Yep. And it's hosted by Mark Evan Jackson, who plays Sean, who also plays Kevin on Brooklyn Nine-Nine.
Ah, yep.
Yep. And then, they do like a kind of episode per show episode and it's usually a cast member and somebody from like the writers or the directors or whatever to come on and talk about the episode.
How many seasons did The Good Place?
4.
4. So wait, go as long as the Buffy.
Not as long as the
rewatch,
Buffy one, no. No, that went on for years.
Yeah. The other person we spoke to today reminded me about revisionist history, who, I'm well out of the loop, so it's good because there'll be lots of episodes for me to listen to.
It will be lots to listen to. That one can be like a huge bummer as well, though.
Spoiler alert.
Sometimes it can be.
Yeah. But anyway, we'll ask our guest soon what podcast he's listening to.
Yes.
Anything else new since people wouldn't know this, but we recorded a podcast earlier this morning with Mike Layson.
Yeah.
So has anything else happened in the last hour or two?
I ate some salad for my lunch.
Okay, we're really getting down to the dregs here, so we probably should.
But I did bake some apple crumble and some banana bread on the weekend.
Actually, I'm on keto
delicious
at the moment, and it smelled absolutely amazing.
Yeah,
I mean anything with carbs in it smells amazing at the moment. But
yeah,
I'm a bit jelly on that one.
Sorry, not sorry.
Yeah. I mean, you didn't even offer me any.
So.
Yeah. Okay. Let's move on.
Yeah, you didn't offer me any of your stinky tuna.
Because I know what you think about my stinky tuna. It's in the name. All right, our guest.
Yeah.
He's joining us from the UK. So
he is.
He's got up really early for us.
Thank you.
He needs no introduction. You wrote this introduction, yeah?
I did.
Well, there is an introduction that follows.
There is, yes.
Okay.
It's not, I'm not just going to leave it there.
He's a repeat guest of this podcast and has served as a host of the UK version of this podcast previously. Well, that really narrows it down.
Sure does. Who could it be?
He has spent decades working to improve the psychosocial conditions of UK workplaces, first as a regulator with the Health and Safety Executive, and now as a consultant through Being Real Workplace Mental Health Solutions. Welcome back to the podcast, Peter Kelly.
Yeah, g'day, Jason. How are you?
Yeah, good, mate. Good to see you. It's been a minute.
I know I don't like your smelly sandwiches either, so I'm with you there, Joelle. Got you back.
Thanks, Pete.
Yeah, sure.
Joelle, have you found any snakes yet on the way to work again?
No, I've not
interest?
seen any snakes
Okay.
on the way to work.
That was several podcasts.
That was a very long time ago now. Yeah.
Hey, Joelle, have you ridden your electric bike into work yet?
No, because we're still in an office that's not very accessible by bike.
Oh, well, listeners, we're moving to a new office in Applecross, which I think will be more accessible. There's a bike path down the freeway.
Yep.
So.
I may. If I can get it downstairs, it's too heavy for me to carry, so I need help to carry it downstairs from my apartment.
Yeah, okay. All right, we'll see.
We'll see.
Check in another 6 months.
Yeah.
Yeah,
probably not, but who knows? Peter, what podcast are you listening to?
I'm listening to scientific ones on like personal development. It's not really sexy, is it? But I think it's really important. Like, when we do a lot of podcasts and we're constantly working in this arena, it's good to do some work on yourself as well. And then obviously a lot to do with the current geopolitical situation that we find in ourselves in. So there's plenty of podcasts on that as well. So yeah, it's slightly boring, but there you go.
Oh, that's okay. And what have you been up to lately?
Well, that's a really good question, isn't it? We're going to be talking about some of that later. Doing a lot of work really around, sort of working with organisations to help them to implement 45,003 as we discussed previously, and also now work around BS 30480, the first British standard, first standard actually globally on suicide prevention and intervention.
Which is what we're here to talk about today.
100%.
Great segue. So, as you mentioned, BSI recently launched BS 3480. How do you abbreviate 3480, Pete?
Man, we got this conversation so many times. 30480.
Okay, 30. It really rolls off the tongue. 30480.
Yeah.
Yeah, yeah. It always used to annoy me when people said 43003
Whatever.
standard.
Yeah.
It's 45,003.
But BS 30480.
Yeah. 30480 or 3,480.
Okay, listeners, we've heard it directly from the man. That's how you are to pronounce this name of this standard moving forward. It is the world's first standard for suicide prevention in the workplace. So, what were the drivers behind the development of this standard, Pete?
Yeah, it's an interesting question, Jason. I mean, what we've seen over the last few years is an increase in suicide as in terms of outcomes and that, and within this space of suicide prevention, there are a lot of people. There are a lot of academics who've done research on it, but there's also a lot of people who've had the very personal experience of losing a loved one, and want to get involved to be able to manage what you do when a suicide's occurred, or what you do when you get people who say that they're having suicidal thoughts or suicidal ideation. So it's been driven by some incredible people who've had a very lived experience from it, and they've been pushing, and they pushed the British standards to have a look and to see if it was possible to do a standard, because we know that suicide impacts the workplace more than ever now. For example, in the UK, there were 7,160 suicides, and that was in 2024. And the previous year, there'd been a 25% increase. So think back to the logistics of the whole lockdown experience, and what we have seen on a global level is a 12% increase in suicide since lockdown. So we are experiencing an increase. It's interesting. When we talked during lockdown, a lot of this was predictable, because back in the Spanish flu pandemic, we saw a similar sort of rise in mental ill health, and also in suicide rates. So I think it was extremely timely that the British standards came together and said, we'll have a meeting where we discuss it in Parliament. And turned up, there was about 50 to 60 people there, different organisations, and said we're gonna do a standard, driven by Marcus Long, who initiated the idea. Marcus lost his son to suicide, but he'd worked in the standards world for a long, long time, and he felt standards could make a difference. And we know standards do make a difference. If you think about ISO 45001 and also ISO 45003, when you give people systems and processes, it helps them to work around situations. So we took the same approach for suicide prevention and intervention.
Yeah, and pretty timely. You're aware, obviously, of the amendment to the Workplace Health and Safety, the Model Workplace Health and Safety Act, which includes notification of work-related suicides and suicide attempts. So pretty timely that the BSI has brought out a standard on this, just as it's coming to more of the front of mind for Australian businesses in particular, if these Model Act changes are adopted by the different territories.
Yeah, absolutely. And what is interesting is that since we launched, we're looking at around about 10 to 11,000 downloads in across 80 different countries with really good implementation. Some of those being in Australia, so we can track where people are coming from to look. So having a guide which is usable across multiple countries has helped. So that was a rationale in the drafting committee that I chaired, was to make sure we had something that people could dip into, use, but was also relevant across different cultures, different countries, and that's what we've attempted to do. And it seems to have got traction. I'm hopeful, and I don't know if this is a question later or not, but I'm hopeful the traction that's got is suitable enough to get us to be able to do an international standard where we bring everyone together. There's a tremendous amount of support and people out there that would be interested in doing that. And what we have to do is remember that in developing the guide, we were developing it for people who might not necessarily have ever experienced suicide. So the language had to be right. The, the 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 things that people could do to let them feel effective had to be right. No one really sat down and talked about having, what do you do when you've had a suicide, or what do you do when you have suicidal ideation in your workplace?
Yeah, no, definitely much needed for sure. And yeah, like I said, great timing for us Australians in any case.
So, can you take us through the process that went into creating the standard?
Yeah, 100%. So we initially had a meeting in the House of Commons, sponsored by an MP, where we went through what a standard might look like, or even if there was a need for a standard. So professional bodies turned up, lived experience people were there, also people that had experience developing standards were also at the meeting. And we came to the conclusion that a standard could be useful in this area. And that was because we were seeing at the time a significant rise. We'd had a big rise, as we discussed before, in suicide. So Marcus Long led on that meeting, and from that, we put forward a proposal to the British Standards Institute to basically do a standard on suicide prevention and intervention, and they took that approach and put together the system that allowed the standard process to be developed. That I was approached by BSI to be the convener of the drafting panel, with the sole benefit of trying to create a document that was understandable and would allow people to dip in and dip out in the midst of a crisis, but also to be able to put things in place to prevent and to react when you have people having, you hear of suicidal ideation. So that process took 18 months for us all to come together. And then, as with other standards, we spent a year in our drafting committee, whilst there was also a comms committee developing the comms. And during that, in the drafting committee, we broke the standard up into the key areas where we felt people needed information of the stuff that would be relevant and useful. And we did that, and then the teams of 2 to 3 people came together. And then when they come together, they were looking at, say, like culture, like prevention, or looking at information that you could do with when you have like a suicide prevention plan, suicide intervention plan. So what we tried to do was to always simplify the language. So there is a term postvention that's used in areas, and I kind of asked them, well, what does post intervention mean? Because I know what it means, but what does it mean to the average person? You see what's happening in the middle of a crisis. Often, you may have a suicide that occurs, and the first person that that we contact, it could potentially be the HR person, but they've not had any experience of suicide. And if we had terms in there that required a degree of understanding of the area rather than simplifying the message, then it might have caused some difficulties. Yeah. So we're set with the task of putting together a guide. So the process pretty much about 2 years, 2 and a bit years. But it was done with super efficiency and quickness, as you'd expect, because the numbers were just a continued rise, and we really wanted, to do something that could impact directly. And I've had some feedback from people that have implemented it and said, that where they've had a suicidal ideation situation, and they've used it to say, oh, we did this, we did that, and they've used it exactly as we expected, which was, what do I do? you know, but there's such I mean, I could talk about this for hours, which I won't, but there's such an amount of things that we can do. People say, how do you prevent suicide? Well, it's like mental health, isn't it? You have to have systems in process to respond and to do things for people when you're alerted to the fact there might be a problem.
Yeah, good to hear that I guess the focus on using simple language and language that's understandable for non-experts.
Well, it's 100%. I mean, it's interesting. I spoke on the panel when we were during the drafting panel. I said, my mum needs to understand this. It needs to pass the mother test. We've spoken about this before, and I did give it to my mother, and she thought, that makes sense. And I thought, actually, if my mum can understand it, then a 23 or 24-year-old HR person who's not really had experience of a death in the workplace may find that they're the point of contact for a call, and they need to know what to do immediately and what not to do. It is amazing it's an unexpected event, isn't it? I've heard, where we've had to advise people not to stop people's salary when they're passed, because actually it's an unexplained and unprepared death, isn't it? So actually making sure that people have got enough money to pay for the funeral, things like that, the very practical things are important. Giving the opportunity for members of your organisation to go to the funeral or to have some form of memorial, all of those things, and that's when we're dealing with the outcome. But what we're trying to do is to say, well, let's look at systems and processes and work that help people to know what to do straight away when you just at the edges of a potential suicide.
Yeah, so Pete, I guess all of our listeners are dying to know what are the elements of this standard, then how do you break it down so it is something that can be adopted by organisations?
Yeah, absolutely. Well, we one of the things we do is we look at culture. We look at what systems that you have in place to manage mental health. We also want to know that you have a suicide prevention plan, which so that it's there, and we go through that in each stage of the standard about the elements that are important to consider. We deal with the myths, which are very important. People saying you can't approach someone if you think they're having suicidal thoughts. reality is you have to, and you should do, because it can be the difference in that situation. We look at the also what you do when you've had a suicide, and how you support people as you're going through that. There's also sections on like a manager's working list to help managers have conversations with people who they might come to them and say, well, I'm really struggling. My head's gone here. It's broken down into seven sort of different areas, and they're all interreacting with each other. And I think that's the important thing. Is one thing doesn't stand alone in isolation. You have to you need at the time of a crisis to know what I need to do immediately, and then you need to know afterwards, what do I do from a lessons learned perspective, of systems. How do I change the system to react? I mean, even things like, there is no global footprint for how suicide is reported. So, for example, suicide in the UK is not really reportable. Suicide in the US is also not reportable as an organisation. So there are different constituents and factors that influence that. Other countries, and I know the work that you're doing in Australia is. So what I'm hopeful is, with the standard, because of the various different elements that we put into it, prompts that conversation, both at a work level, and also at a organizational level, and also at a national level. This is the numbers are not going down. What was in when we say 20 years ago, when I was looking at suicide in the workplaces when I was at HSC, suicide traditionally was 40 to 55. Now we're looking at 25 to 65. So it's the whole working age range. Workplaces are being touched by potential suicides or suicides more than ever. So, so this guide is there to take you through the different systems and different processes.
I'm interested to know, Pete, in the standard, the relative weighting of suicide prevention versus postvention. I'm assuming, given it's a prevention standard, that there's a greater focus on that rather than the response.
No, there isn't. It's actually it's actually equal, because we realise that you have to do something. There's a clear cut system and process you have to follow when it's postvention. You've got to learn from when a suicide occurs, or when a suicide has not occurred because you've intervened. So you have to learn that those processes. If an organisation has systems in place where it says, okay, we are going to, we've had this situation, what do we do? Then you're basically prepping the organisation for what they should be doing when it arises. The impact of a suicide in a workplace doesn't just impact one person; it impacts the entire organisation, and it has a lasting impact for a number of years. So post intervention, and I hate that word. Okay, I don't like it. Nothing, because it's too academic. What do you do when you've had a suicide, or what do you do when someone says that they're feeling suicidal? What do you do afterwards? Do you go, oh, that's it? Or do you make sure you put systems in place to learn from it, to protect people? So if someone's having suicidal thoughts, do you have any AP? Have you got provision to take them straight to the hospital, or to get to assist them going to the GP? All of those things that are in place. If someone tells you that actually on a Friday, I'm having these suicidal thoughts. Well, what do you do? What system do you put in place? Do you wait until Monday?
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy, www.45003.org. Now back to this episode. I'm interested, Pete, does the standard differentiate between suicide by work-related versus non-work-related causes?
It does. So I was thinking about this before we came onto this call, which is, what determines if it's work related. We only know the ones that have said, actually, my decision to attempt suicide was work related. Okay. Or we have evidence from coroners that the deceased indicates that work pressure was a major factor, or bullying in the workplace was a factor. So, in terms of identification, often it's identified afterwards. So one of the reasons about having the standard the standard that we've got was, well, if you were able to do the prevention element, you're picking up on the potential risk and responding before you need to do it. So I think that's a unique bit of doing intervention and prevention, and also learning the lessons of what you've gone through. We know that if someone indicates that work is an indicative reason, then you're duty bound to do something about that. And often, I'm trying to think of a suicide case where the employer was directly told that the work pressure was too much, and it was they couldn't sleep, and they were having suicidal thoughts. And I know of a couple of cases, so where the outcome was that the person died by suicide. So in that case, you've got to learn from that lesson. It's like having an accident at work and going, oh, well, we won't do any review, we won't do anything about it. We've got to learn what we can do differently.
Yeah, I just think when it's, like you say, it's hard to know definitively, except in certain circumstances, that it was work-related versus non-work-related. But I think in the case of if it is identified as work-related, there's more that the organisation can do to review and improve systems versus non-work-related factors.
But, well, maybe, Jason, maybe, because also non-work-related factors are factors that come into work, aren't they? So they are the hazards that are coming into work, the psychosocial hazards that come into work. So if we know something's happening to somebody at home or in their personal life, we have to factor that in when we're working with people. I mean, this is where the alignment with 45,003 comes into place, which is there are factors in work that sometimes, and factors outside of work also, that can influence it. So what I do know is, if the World Health Organization saying that there's a 12% increase globally in suicide, we are in a better position than we were 3 years ago, when we didn't have anything that we're doing. And I've been clear all of my working life on what happens at home, what happens at work. There's an interplay between the two, and I think if we know we've got someone who's going through a really difficult time, and actually they might be alone or isolated at home, and then they come to work and they talk about how they feel it, how they're feeling, and how this might be impacting them, we still have a duty of care to do something, don't we?
Yeah, absolutely.
The psychosocial factors are there, whatever, what we're trying to do. And one of the reasons when we looked at the standard, the suicide standard was we considered and considered it as being aligned with 45,003. We were using similar language. We talked about psychosocial risk in that.
Yeah, so I guess what you're kind of getting at there, Peter, is like, say if we know that someone's going through a divorce, we might look for opportunities to reduce workload for them while they're at work, or assign them to work that we know is maybe going to be less stressful, or maybe less types of opportunities for interpersonal conflict or that kind of thing. So, while we're not able to actually change what's happening for somebody outside of work, we can sort of modify their experience at work to help them have more capacity to cope with what's going on at home.
Yeah, and it may not even be structural things like that. It may be simply recognizing that somebody in their workplace gets on with them very well, and making sure that they work together, or that there is a possibility. Do you know what I mean? Um, it might be that he doesn't have any mates. Well, that's still it still doesn't stop us from doing something. You know what I mean? We have to sort of you can get people to sort of align people. Train your managers about what to do. Train your managers to have conversations, not to be scared of those conversations, but actually to see them as something, as a normal conversation. And it's fascinating, I mean, for us, we worked in mental health for many years, and there's still, even amongst professionals, uh, an uncomfortableness sometimes having conversations, and yet conversations are the starting point in many cases to getting at people on the pathway of prevention.
All right, so this is a guidance standard rather than a certifiable management system. What does that mean for people who are not standards wonks?
Oh, what does it mean? I wasn't a standard one until I did 45,003.
Yeah, but you are now.
Yeah, interesting, isn't it? Very much against standards, even though I did help develop management standards. That was the first standard, so maybe the reality is that this is probably always going to be my life journey. It basically means that it's not formalized in regulation. So it's not a defined standard which has a criteria of definitive things that you have to do or you should be doing. So a defined standard would be ISO 45001. Oh God, I'm geeking out here. I'm so sorry. Um, but that has a defined set of characteristics. You need to have a management system in place. That management system needs to have certain elements to it, which led really to why the psychosocial risks for ISO 45003 came about, because there was no formal way of identifying psychosocial risk. But even that is not a defined standard. So I guess in answering your question, it's where the standards world comes together and says, we're going to give a characteristics or elements what we expect as a minimum to be there. And if they're not there, then that would be a breach of the standard. I think we could do that in a whole range of things that we're not doing it, but that's a whole nother podcast.
Okay, so the guidance standard is literally that, to provide guidance, but it's not something that you're certified to or audited against.
No, and I think although I do know people are attempting to look at that, but to do that first, I think the most effective way is to have an international standard where you get universal agreement on what we can do and how we should do it. I think that's so. But I did anticipate when we launched this standard that it'd be popular. I didn't anticipate it would be so popular so quickly, which does kind of reflect the fact that there's a desperate need out there for a gentleman, a guide to take you through. And even in my own practice, I have developed a user guide to help you to interpret the standard in Peter language. Because
How's anyone going to decipher that, Pete?
I don't know. Yeah, but it's fascinating. The take up's been good. There's some we know, some companies that have used it. We also know it's been actively used where there's been a suicide, and it's worked. And that's, what, we said this on the drafting committee, and when I was together, if we make a difference to one life, then this is worth it. You know what I mean? And it's the kind of thing you don't hear about until after the fact, or and I I hope that that what we'll see over the next couple of years, with the introduction of suicide prevention plans and suicide sort of an intervention plan, that what we'll begin to see is people picking up things a lot earlier. But if they don't pick up, what are we going to do to support people? No, I literally have advised companies who said, "Well, we're stopping that." I know I mentioned this before, but it's a person has died, but they stopped the salary, and it's like, how's the family supposed to pay for the funeral? It's just small things that we need to think about when we do have it. But I've always spent my entire working life looking at prevention, and this is something I thought, well, we need to prevent. We need to put systems in place. We need to look at culture. We need to look at environment. We need to look at the context in which things are occurring. We need to know what we do when we have a problem.
Pete, obviously there's been a huge amount of downloads, which is phenomenal. Have you had any feedback directly from employers regarding how they've been using the standard?
Yeah, yeah. So some have gone on and have started their work on their suicide prevention plans. They're doing training with their employees around having conversations. We have information in there about the conversations that you can sort of have. Some have done training around the myths, because we put in what the myths were and why the myths were not what they are. There, as I've said before, there is where unfortunately someone has had a suicide. The guy came in handy straight away and was useful to help that organisation. I'm fairly certain, over the period of time that this continues to go, but we'll hear more. And so it's across the sphere. It's when something happens, you react. What do you do? But it's also the prevention thing. It's about having sensible conversations. And 1 in 13 people will have suicidal ideation in any workplace. So you could have people that have had suicidal ideation at some stage. With the numbers here, which is 7,170 and 24, and last year the similar numbers, you can ask any of your statistics in any of the countries that you're involved with, and people that listen to this podcast, and see similar issues. Use the statistics to motivate the conversation. I think you're fortunate in Australia to be able to have that legislation and the work that's being done there. But ultimately, the motivation for this guy was to make a difference. So, Marcus said his legacy was that he wanted the legacy for his son was this. And that's a powerful motivator to keep you focused and keep you working. I honestly, some of the people that you meet and engage with here, it's hugely a privilege, because to work alongside some people who've experienced loss, and to walk that journey with them. So Jordan's legacy over here, Steve, who runs that, lost his son, and yet we're going on a walk in the morning, out of the darkness into the light. So we're doing a walk in a couple of weeks. So it becomes part of, I think, your own life when you start on this. when you look at this, you look at suicide, and there's a lot that we're trying to do.
So, Peter, what would you love to see happen as a result of this standard?
Uh, and it sounds really sort of simplistic, but we save lives, and we can save lives, and we know that we do it. But we also have systems and processes in work to deal with this. If 1 in 13 people can be impacted by it, or that we know that actually from those organisations that have experienced a suicide, that the impact is phenomenal. If we can change the impact, if we can get people to be doing something to prevent, and it saves their life, then that's really important, because you come to work 40% of your life, you go to bed for 40% of your life, and you spend 20% watching football or rugby. Or not necessarily those, but in Jason's case, maybe rugby, or basketball, because he's a tall fella, isn't he? But the point being is, work is a key provider and a key point of contact for what happens to us socially, emotionally, and physically. So we've tackled the physical by looking at appropriate safety systems and management systems in place. We're tackling the psychosocial hazards by ISO 45003. We use the standard on suicide prevention as an obvious choice, as an obvious sort of expression of that, what we're trying to do there. So I think I'd like to see them aligned. I'd like to see an ISO. I think 11,000 downloads probably constitutes that there's a lot of interest to do it. And we do the work, and we're very lucky, to know from feedback that this has helped people in that moment of crisis, and this has helped an organisation to do that. So isn't it interesting, Joelle? It's this mental health thing, isn't it? we've got to have a normal, sensible conversation on mental health, and we're doing that. But I don't know. Could this standard occurred 15 years ago, 10 years ago? I don't know. Probably not. But we still had people dying by suicide, and there were people who were in work or used work as the means for suicide. So we should be. I'm hopeful that it becomes accepted, like 45,003, as something that we can do practically.
Worthy goals, I think, Pete.
Yeah, yeah. Whether or not they achieve them in my lifetime, I don't really know. But this is not what we came in.
I'm sure ISO is watching, and like you say, the downloads would definitely motivate them to think about an international standard. So keep feeding that data, Pete.
Yeah. Listen, Jason, all of us came into this job to do one thing, which is to get people home healthy and get them home in one piece. Those are the, and it's this is just that's part of the equation of what we're trying to do here. And I know that sounds really woolly, but that's what has got me up for the last 30 years. And mental health is a part of work, and also suicide can impact work, can be a part of work. I'm working on with a professional body on how to manage suicide, and so I think that wouldn't have been there 2 years ago, and it is there now. So yeah.
Terrific. Pete, you know how these podcasts go. We always save the best two questions for the end. So I've asked you this question many times before, but I'm interested in what your most current response is. What are your hopes for the future of workplace mental health?
What are my hopes? My hopes is that it gets parity with physical health and physical safety. And that actually people when they go into work, they're not made ill by work. They're actually they come home the same and hopefully better for it. And whether or not we achieve that in my lifetime, I'm not 100% certain. But I'm not going to change my narrative, and I'm not going to change my beliefs, which is that if you're going to be real on mental health, like you should be real on exposure to only multiple things that are likely to cause you ill health. So there's too many. There's still a lot of people making excuses. I'll do that. I don't know why not. Why not? It's your biggest health issue. You've got to do something about your biggest health issue, haven't you?
All right, Peter. Words of advice for people who are wanting to work in the field of psych health and safety.
There's some advice. Don't do it. No, I'm joking. If you're going to work in the field of psych health and safety, take your whole self into the work and think about work as not just being outcomes. It's actually a whole ecosystem of things that are going on, and we have to basically look at hazards that are in the workplace and think what are they, where are they, and what do we do about them? And then once they become a risk, how are you managing that risk? I think it's a great area to work in. I set out in clinical psychology and ended up in this field, and I'm very fortunate to have ended up here because I think I've found something that drives me. But equally, I think you need to have you need to have you need to have motivation to keep going, because sometimes you do come across obstacles. And apologies for my alarm going off, which is normally the time I get up, Jason.
wow, you got up really early.
9 a.m. 9 a.m.
It's a hard life. So you can hear, if you get into psych health and safety, you can wake up at 9 o'clock in the morning.
Wow.
Well,
Wow.
not if you're obviously stuck in traffic in Perth and you're trying to get in. You'd have to get up earlier. And mind you, there are only a few places in the world you get to see dead snakes on the way into work. So that has stuck in my mind as an eternal memory of my perfect experience. I saw a dead snake today. I'm like, nice. I shake my boots, and I live in the UK, but I shake my boots when I get up in the morning, just in case. And the spiders here are really small, but so not like the big fellas that you get back home, but yeah, actually, I saved a spider yesterday. He was in my shower, and I opened the window and let him out. So sorry, I'm getting a bit.
You're off track.
Very off track.
Hey, Pete, something related to the topic of psych health and safety, not spiders, is the conference, the Psych Health and Safety Conference. Now, you've been the last couple of years. Last year, I was really brave and gave you a microphone. You're on stage. I've decided to rescind your microphone privileges this year. But it's in September 8th and 9th in Sydney. People want to know, are you going to be coming to town if they want to catch up with you?
Oh yeah, 100%. This is the conference that I go to. I've felt like a lone warrior for a very long time. That people weren't really doing what we were doing on psychosocial risk. So to have a conference on it, and to see the work that you and Flourish have been doing is, yeah, I'm there. But I'm not there just to meet my mates and to wear flowery shirts, as you said to me. I'm there to learn from the people around us. I was sat back and I was watching some of the case studies last year, and I'll be honest, I was a bit emotional because I was thinking, yes, we are actually doing stuff here. We're finally getting through, and to see this, we're to see us doing things is really, really important. It's been a lone journey at times for some of us who watched and thought, are we just weird? Are we weird to try and make workplaces better? Just because actually there might be something not right with the hazards out there. So I'm there. It's okay, Jason. I've got microphones wherever I go in the world, so But I'll have you back when you need me. And I promise to
Well,
behave.
your good mate that we did the road show with the week before, David Daniels, has worked out a way to be there as well. So again, he's not on stage this year, but he'll be hanging out because, like yourself and us, he's a psychosocial safety nerd, and he loves to just immerse himself and meet people in the community. But I was going to put it out there for you, Pete, to help fund your trip over. If there's anyone interested in getting Pete to talk about the suicide prevention standard, then Pete's going to be available on either side of the Psych Health and Safety conference dates. So do reach out either to us or to Peter directly if you'd like to get him in to have a conversation.
I'll be there. I'll be there for the 3 weeks approximately. Yeah. It's a long way to come down, subject to flying over the current situation we find ourselves in.
Yeah, that's right. Well, Pete, it's always a pleasure, mate. So thank you for coming on and sharing some of your insights regarding the standard. And looking forward to having you on again. Hopefully it doesn't take a whole nother standard to get you back on. Remember, listeners, we do record these over video when we have the conversations with our guests. So head over to the FlourishTX YouTube channel if you want to see some of our past conversations. We also take the clips, the best of the best bits of these conversations, and put them on the FlourishTX LinkedIn page every fortnight. So follow along there if you haven't already. And if you want to continue the conversation, or if you want to book Peter in for something to talk to your staff, then he's available in September. But you can contact all of us via LinkedIn. But thanks a lot, listeners. We'll catch you next episode.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow FlourishDX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.